Hi, I'm Dr. Lori Landrio. I'm an optometrist in Merrick, and I had the pleasure of working with Kenny Velez this week for his last visit, but 4 months before that we had lots of fun as well. And I would suggest that if you guys have any questions or anyone wants to come by my office, to do so. My phone number is 516-546-4800, and you're welcome to come by. I think Kenny has some questions for me, and I'd be happy to answer them.
First question, how did you decide to pursue optometry as a career?
I guess you could say that I was living with difficult vision. I was very highly nearsighted and needed my glasses from the moment I woke up in the morning to go to the restroom or to probably even tie my shoes. So I started working as a receptionist in a local practice, and later on became friendly with the staff, and they encouraged me to go to optometry school. So that was not easy. At that point I already had a child, and I could suggest to try to pursue your careers early in life, but it was really by default, I guess, that I came into the career. I had been a paralegal before that, before having a child, and it wasn't my dream, so I decided to go with my dream.
Okay. Next question, do you enjoy working with your patients, and how do you deal with difficult patients?
For the most part, I enjoy working with patients. This is a very people-oriented business, and I think that when you're dealing with a difficult patient, you have to consider their anxiety. Many times people come in and they may be getting news that they're not going to be able to see well because they have cataracts, macular degeneration, glaucoma. You may be suggesting that they need surgery or need to go for a second opinion, and those things can make patients very anxious. So I try to put myself in their shoes.
Can you explain your responsibilities and duty as an optometrist?
Sure. I have a responsibility to consider the patient's visual needs in terms of the glasses or contacts that they are choosing. I have a responsibility to make sure I educate them regarding their eye health. It's not all about 20/20. It might have to do with focusing of the eyes, not just seeing. It may have to do with deficits of the eyes that are a result of health. So I need to recommend primary care visits, cardiology visits. If you have high blood pressure, diabetes, even cholesterol, it may be indicated in your eyes by leaking or bleeding of those blood vessels that Kenny mentioned. And I think it's important that we package your eye health with your systemic or whole
Would you
body
recommend
health.
optometry to people?
Yes, I think if you like working with the public, I think if you are interested in eye health, if you're interested in the medical field in some way, but you need to be passionate about what it is that you do, because it shows. Many people say to me, I can tell you love what you do, and that makes me feel good because I do love what I do. And I think if you follow your heart, you're probably going to be better at whatever you choose.